Morning, everyone. Dr. Charlie here, PT, and just had something that got me fired up this morning, so wanted to share. So this is for all the healthcare providers out there. So basically, in a short few words here, like if you don't know what the heck you're dealing with, then you shouldn't be dealing with it at all. So basically, when in doubt, refer out, right? This morning I had a massage therapist post basically a pain body diagram on a group that I'm a part of. And wanted to know how to best treat this person because she had never treated or seen anything like it. Well, basically, like newsflash, again, if you don't know what you're doing or you're not properly trained to, medically screen, differentially diagnose, and even if you are, and you have no idea what you're doing and or what you're dealing with, or you have no clinical rationale as to what you're doing or a plan that makes logical and sort of clinical sense based off clinical expertise, the evidence that we have, and based off what those patient goals and values are, then you shouldn't be dealing with that person at all. So this isn't anything against the massage therapist. It's just that people nowadays are sort of reverse engineering where they get their care. So rather than going to, a physical therapist first, rather than going to, a physician, during the appropriate time, etc. On the healthcare side, people are shifting towards these kind of like complementary alternative medicines, which I guess as a physical therapist, I guess I fit into. But really, what they're doing is they're for their back pain, they're going to the yoga therapist, they're going to the personal trainer, they're going to the massage therapist. Now, again, it's nothing just against those people, but those people aren't adequately trained, obviously. So if you're a patient watching this, those people aren't adequately trained to understand what's going on. Just because they teach a class means nothing. Now, why do you, maybe if you're watching this again and you're a person in pain or you're a patient, why do you go to those people? Probably because you know, like, and trust them. So people are more willing to do business with people they know, like, and trust, and those people spend time with you. So as a healthcare provider watching this, we have to get out in the public and we have to start to educate people and be available. I asked a couple people what they thought of, kind of doctors in general. And the one term they used was sort of like inaccessible, right? So like here we are sitting in our offices and, we want to get in and it takes a month to get an appointment and we can never get a hold of them. I, as another healthcare provider, can never get a hold of some people. And we expect, patients who pay good money for their insurance nowadays and, have some serious concerns. We expect them to call, never be able to get a hold of us, and then they can't get a hold of us and they set up an appointment. It takes a month to get an appointment, and then they pay all this money, and we show up and we don't even shake their hand, don't even introduce ourselves, and and they expect us to, and listen to them, or listen, I don't think that's a good word, whatever, chat with them while we're typing on our computers and spend 5 minutes with them, and then we expect them to dish out all this money and see value in what we do, and it just makes no freaking sense. So point is that I started off this rant with basically idea that if you're not sure what you're doing, and I don't care who you are, if you are another physical therapist watching this and somebody comes to you and you have no clue what you're doing, either you have to reach out for mentorship, number one, okay, and or you need to refer out. Maybe it's to your buddy down the next door, or another therapist in the room, or in the case of, I would see this all the time, if somebody comes in and you treat back pain, neck pain, knee pain, all the time, and that's your bread and butter, and somebody comes in with hand pain and you are a certified hand therapist, or you're a PT and you have a certified hand therapist right there next to you in the same building, right? And somebody comes to you with hand pain, please refer that person to the CHT, the certified hand therapist. If you are a PT who never sees, kids, and a young, like a baby comes in, or like a very young person comes in with some neurological condition or something like that, you're not used to dealing with, please find some pediatric specialist. All right, this is why we have specialties. We can't be everything to everybody. And the only person at the end of the day in these scenarios that's suffering is the patient. So I think that's it. Basically, when in doubt, refer out, and realize like why we do this in the first place. This isn't so that we can make more money, although that would be nice, right? But this is so that we can help people, and help people. The people, or the person, sorry, is the center of all this. The only person who's going to lose is the patient. So that's it. It's my it wasn't meant to be a morning walk, but I took one because I was on fire this morning. So off to the gym. Happy Saturday, everyone. Crush it this weekend, okay? Later.